It's so wonderful to be here with you all today. For those of you who I don't know, I just want to briefly introduce myself. The San Francisco Chronicle once called me Congress's watchdog and single mom. And both of those things are true. I live in Irvine, where I am raising three lightly supervised children. And the second part about being a watchdog is also true. I really, really love oversight. I drive a minivan that has the California license plate that spells it out. OVRSITE. And so believe me, when you have oversight for your license plate, you come to a complete stop at every stop sign. I wanted to talk with you briefly today about one of the most important duties of the House of Representatives generally. I know people think about the House, they think about bills being passed, or as it's been lately, not getting passed. But oversight is a really important duty of Congress, of the House and the Senate. It is about being a watchdog for families, for our budgets, for our tax dollars, for our retirement savings, for our health care. And I often say the purpose of oversight is to really close that gap between what the law says and what the law does. So the promise of Medicare is that older adults can get the health care they need without going bankrupt or into crushing debt. Traditional Medicare delivers the highest quality of care with the most choice and the lowest cost. But that Medicare program and its long-standing successes have been threatened by programs like direct contracting and into the hands of equity firms with no healthcare experience. And so the rise of Medicare Advantage plans have taken private insurers' greed and abuse and imported them into Medicare, hurting both taxpayers and seniors. And I've seen of cancer called hairy cell leukemia. As he sought treatment for his cancer, he was by who had experience treating this rare disease. His doctor did his best. He called a specialist for help just 2 hours away, but my dad couldn't see that doctor because he had the disadvantage of having so-called Medicare Advantage. We see it in the commercial. I don't think we should take their word for it. So I've introduced legislation to force insurers to give policymakers and patients data on the coverage, on the claims, and the denials. And we need to be looking at the tax expenses of Medicare Advantage too. If Medicare Advantage is as good as those infomercials say it is, let's see the numbers. Let's do the oversight to see whether the promise of Medicare is being fulfilled. Another commitment that we make to Americans is to Social Security, that it will be there for them when they retire, and that it will be the only member of the House of Representatives to ever receive the Social Security Champion Award from Social Security Works. And it's because of that government is keeping its promises to seniors. I am a proud sponsor of the Social Security 2100 Act and remain incredibly frustrated that both Democrats and Republicans, regardless of which party is in charge, have refused to put the Social Security Act 2100 on the House floor for a vote. It's not enough to just say you're a sponsor. You need to be pushing for an actual vote. So when I'm conducting oversight, I'm looking for whether government is making a real difference in people's lives. That means exposing areas where we're not getting the job done, but it also means building on successes of programs that are working. So for example, Medicare should cover vision, hearing, and dental. It should be able to negotiate the prices for all drugs, not just 10 a year. And it should be available to all Americans, because it is the best health care and the best patient network of any kind of health program that we have. Regarding Social Security, the so-called WEP GPO penalty that harms public servants. We should strengthen the cost of living adjustment. We should correct the disability benefit cliff. And to do this, we just need to make wealthiest Americans pay their fair share to scrap the cap. The Social Security 2100 Act that will let us avoid a projected drop in benefits. But instead of having those conversations, instead of squarely taking on those fights, Washington politicians are still fighting the same fights that they have been fighting for decades. We are still fighting to avoid efforts to privatize Medicare, like I talked about, through direct contracting and Medicare Advantage. We still have Republicans in Congress continuing to propose cuts to Social Security. These are not debates that we should be having in the 21st century. We now are approaching 100 years of evidence that Social Security delivers for seniors. And the only question ought to be, how do we strengthen it? Not just how do we protect it, but how do we make it stronger? The reason why so much of our political discourse is like a bad version of Groundhog Day, again and again having the same conversations, is because of the dominance of special interests that drown out what our families and our seniors need. I am the only congressperson in this race who has never taken corporate PAC money, not one dime. And I didn't change my position on campaign finance to boost my credibility in this Senate race. It is core to who I am and why I do this job differently. Corporate PAC money corrupts Washington. It corrupts decisions and it corrupts outcomes for everyday Americans like you. I'm the same with federal lobbyist money. I don't take it and I don't want it. And I'm the only person in this race who can say that. Federal lobbyist money is bad for politicians, bad for democracy, and again, bad for Californians. I am not a creature of institutional Washington. I haven't been in office for decades. I don't do Congress like others do because I'm not afraid. I'm not afraid to call out congressional leadership or corporate executives who let us down. This is California's opportunity to send a warrior to the US Senate who's going to shake up the system and make sure that we are putting in place building blocks for not just our today's seniors to be successful and to thrive, but for retirees and seniors in today's workforce in decades ahead to do even better than we have been able to do. I hope you'll pick the right woman to be your next US Senator. Thank you so much for having me.
Hi, Katie. Katie, do you have time for a few questions and answers to answer a few questions?
Katie, I should, yes.
You want to ask Congresswoman any questions? This is your opportunity. All those out in Zoom land, if you just raise your hand and we will call on you. Okay, we do have a question. Yes, the man with the Act Now hat on.
Why is it that you do not vote in favor of earmarks? But earmarks are a way that your state can be helped.
The question is, why don't you vote for earmarks when
And some earmarks could help Californians, could help other states when you vote for those.
when earmarks could help those in California and in other states? Earmarks.
Okay, great. So earmarks are, let me make sure everyone knows what an earmark is. An earmark is a deviation from the normal government funding process. Normally, what we do is we look at what Americans need. Say they need additional funding for Medicare Senior Patrol to prevent fraud in Medicare. And we allot money for that. And then the administration decides where that money needs to go. Earmarks change that process, fund politicians' ugly history of corruption with regard to earmarks. And the process inherently invites favoritism and corruption. And it replaces the judgment of experts or expert federal workers with the judgment of politicians who are trying to do paybacks and political favors. So I will always fight for California to get its fair share of funding. And I can give you some examples of how I have done that, advocating for infrastructure projects like the billions of dollars we brought home for Irvine Ranch Water District to be able to build a huge water recycling center, groundwater storage facility, the way I fought to reverse the punitive funding formula that hurts about earmarks. We have a Southern California member who went to jail, prison, for having a menu of earmarks. If you donated this much, then you got an earmark for that. And it's not just the past. We have a member who funneled earmarks to the nonprofit where his wife works. We have a problem with trust in government. We need to restore it, and we're going to do that by having transparent processes. The last thing I want to flag is the research is crystal clear. Earmarks discriminate against the lowest income and most needy Americans. The money does not flow where it is needed
Because we are
authority and political clout. And so I want to make sure that that money is going where we most need it.
we're the
California to get its fair share, but I don't think politicians ought to be trading political favors to decide which bridges are safe and which nonprofits have resources to help people.